Hello and welcome. My name is Sean Simmons. I'm a physical therapist, and today we're going to be talking about lumbar arthritis and degenerative joint disease. What exactly is arthritis and degenerative joint disease? In general, arthritis and DJD are used synonymously. And they both basically mean that there's wear and tear occurring at the joint. This is usually a process over a period of time that can be sped up or slowed down by a number of factors. In general, the disc, which sits between two adjacent vertebrae or bones in your spine, shrinks and or is worn out, and this usually occurs through the loss of fluid in the disc itself. This can eventually lead to what's called stenosis, or the narrowing of the joint space. So you see in the picture on the right where the nerves, which are yellow, are coming out of the sides of the spine, and the space that they have to come out is decreased when you have arthritis. And this decreasing of joint space where the nerve comes out is called stenosis. If there's any good news from this, it's that you're not alone, and far from it. Low back pain is the most common pathology seen in physical therapy clinics, and a lot of that is due to arthritis. Arthritis on the whole affects nearly 46 million adults. It is most common in people over 60, although the earliest signs of arthritis can be seen as early as your 20s. It can affect children and adults, and is a major cause of disability and costs in the U.S. economy more than $124 billion per year, and that number is only expected to rise as the average age of our population rises. I'd like to pause for a minute and talk about imaging, whether that's x-rays or MRIs or whatever you have done. The nice thing about these images is that it gives us an idea of what your anatomy looks like. How does your spine look? How are the discs looking? Do the nerves have enough room to move? All of these things you can see in x-rays and MRIs. The negative effect of these is that just because your x-ray or MRI shows that you have something doesn't mean that you're going to have pain. So there are a lot of times where people come in with maybe a 1 or a 2 out of 10 pain when they see me, and then they get the results of their x-rays or MRIs, then all of a sudden their pain shoots up and they're hurting and they feel there's something wrong with them. The truth is, approximately 3/4 of imaging are going to show some kind of abnormality, and this does not mean that you have pain or will ever have pain. There are plenty of asymptomatic people, or people without pain, that will have an x-ray or MRI that shows something wrong, and they may never have pain. So again, I think it's just important to remember that just because your x-ray or MRI shows something or doesn't show something, that does not necessarily correlate to the level of pain that you're experiencing. What are some of the signs and symptoms of your classic or typical arthritis? The primary symptom is stiffness, especially for those first 30 minutes upon waking up in the morning. You may have some stiffness during the day, but this will primarily be the worst, the first 30 minutes. Overall, decreased motion in the joints, pain, local tenderness, and potentially some numbness and tingling in the hip, thigh, leg, and foot if there is enough space lost and there is pressure on a nerve. There are many causes and factors to consider when looking at arthritis and degenerative joint disease. A hunched posture is a major cause. People sit at their computers with the worst posture possible. This posture, or any number of repetitive, longer-lasting activities, can lead to wear and tear over time. It's also possible that a traumatic injury earlier in life, fractures, car accidents, that kind of thing, can lead to arthritis later in life. Then there's the lack of deep abdominal endurance, and that's something that we've covered already, and something that's important to improve and maintain. A sedentary lifestyle, not stimulating the muscles and the bones and the discs, can lead to arthritis later in life. Obesity is a problem because it adds so much stress to all of the joints that over time it can wear them out. Bony deformities and an increasing age, again, not something that you can have that much of an effect on, but something to consider. What if you don't have it yet, and this is all sounding pretty bad and you'd like to prevent it? Or maybe you just have small evidence of it and you're looking to prevent it from getting any worse. How do you do that? My absolute first step is improving deep abdominal control and endurance, and there will be a video after this slide giving you a quick idea of how to do that. But this is probably the single most important thing. The abdominals are neglected far too often, and we're not talking about crunches or sit-ups. We're talking about abdominal control without affecting the spine negatively. Posture is a big thing. People sit too much and they sit with terrible postures. You need to keep your spine in a neutral, erect posture as often as possible to better distribute the forces on your spine. Again, maintaining a healthy weight. Obesity over time will wear out the joints and lead to arthritis and degenerative joint disease. Regular exercise, any and all exercise, strengthening, flexibility, cardiovascular, endurance, these are all good to maintain a healthy spine. Avoiding smoking and high-impact activities. The smoking can damage the blood flow to the region and create any number of other problems. High-impact activities, they've shown that trauma can eventually lead to arthritis later in life, so anything involving collisions is probably not a great idea. What if you're seeing early signs of arthritis? What do? There are a number of medical professionals that you can go to for tips and advice and recommendations. A nutritionist is a great place to start to improve your diet and lose weight. Physicians can prescribe medications and injections if needed, and different types of vitamins. Physical therapy can provide you with specific and controlled strength and flexibility training, and also offer a wide variety of manual or hands-on interventions to reduce any pain that's occurring and improve pain-free motion. Personal trainers are good at offering generic conditioning programs to strengthen your body as a whole. And any chance you have to utilize aquatics or aquatic exercise is a great idea because it reduces the stress and strain on the joints and can also lead to improved conditioning. If it's reached the point where it's everywhere and you know you have it and it's creating problems with pain and deficits in your ability to be independent, then what do? Your options are all still the same, but I more strongly recommend going to see your physician and going to see a physical therapist. Again, the physicians have a number of injections and medications and hopefully not, but potentially surgeries that they can perform to get you back on your feet. Physical therapy, again, uses a series of specific exercises, manual or hands-on techniques, and a number of other pain-reducing modalities, including electrical stimulation, dry needling, and other modalities. If you've decided to exercise, the next question is always, well, what types of exercises are safe? Which ones aren't going to make this worse? My first suggestion is obviously consult your physical therapist. They'll have a great idea on how to set you up with a safe and beneficial program. But in general, low impact exercises, lots of cardiovascular exercise, stretching, gentle strengthening and aquatics are all safe and good for you. The next question is always, how often should I exercise? And this is where I lose a lot of people because it sounds like a lot, but really in the grand scheme of things, it's not. The short answer is daily. And every day you should spend 30 minutes doing cardiovascular training, riding a bike, walking, swimming, and 30 minutes of resistance training, lifting weights, using the machines at the gym, etc. And then if you can manage it, try and squeeze in another 10 minutes of flexibility. And this just needs to be general flexibility, but it's a forgotten component that would add a lot of benefit to your routine. Thanks again for watching, and please make sure to check out my website at specializeddnc.com and my Facebook page at facebook.com/specializeddnc. Thanks again.